have the Director General of Ghana Health Service and his team here to give us updates on 4 major things: on COVID, the vaccination program, monkeypox, and also on flu. Before I call on the Director General to give his substantive presentation, I would like to acknowledge some dignitaries who have joined us this morning. With us is the Head Expanded Program on Immunization, EPI, Dr. Kwame Amponsa Achiano. We also have Director Public Health, Dr. Franklin Asiedu Bekwin. And of course, the Director General of Ghana Health Service, Dr. Patrick Kumar-Boaji. Also, I would like to acknowledge all the journalists who are here with us and also our government spokespersons who have joined us this morning. So without wasting my time, I would like to invite the Director General of Ghana Health Service for his presentation.
Thank you very much, Honorable Minister, and good morning all. Once again, we are back to give you a briefing on a number of issues as far as COVID is concerned and other health-related matters. I think of late there have been a series of events of health that we need to use this opportunity to clarify and give you an update on what is happening as far as the COVID is concerned. We will give you the update on COVID situation. As you're all aware, there has been a surge in the last few weeks. Vaccination, exercise, and activity that's going on for COVID. We'll give an update on influenza A3, I'm sure, H3N2, that is out there, which was accidentally christened as Hans virus. We'll explain that to you. And then the situation of monkeypox in the country. Generally, we have seen a rise in the cases over the past few weeks. Currently, we have about 400 active cases. If you look at a situation where we had probably less than 20 stage in the last few weeks, that is an increase. But this is largely an Accra phenomenon. I would even say it's Greater Accra. It's an Accra surge, mainly, not Greater Accra, and we'll explain all that to you. The sporadic outbreaks are related to events including schools, outbreaks, and work-related outbreaks. So it's in the schools and mainly in the workplace. But of course, we all close from work and go home. We all close from school and go home. And so now it goes into the community. We are seeing very low positivity at the airport lately. And the Omicron virus variant remains the most dominant still. And then currently the uptake of vaccination has also significantly come down. And I think it's an important wake-up call. Generally, we have recorded about 162,000 cases. We have done more than 2.4 plus million tests. About 160 of the 162,000 have recovered. Unfortunately, we've lost about 1,445 cases, and we have not lost any person to COVID since early March. The active cases as of the 6th of June is 452. So you can see that's a real hike. It drops and it goes up based on the number of cases that is coming in. Currently, there's no severe or critical case, and we are very thankful for that because that is also an indication that the vaccine is protecting us. The next slide just is the general trend to show the various 4 waves that we've had so far. And then you can see towards the end there's a little hump that is rising. as a result of the current upsurge. And obviously, we can see that the protocols are significantly down, so our protection is quite low. Now, let me also show with you where these 400 active cases really are. The majority are not in Greater Accra, in Accra. As you can see from the chart in the red spots, their downs and areas are quite, and we have about 4 cases in Eastern region, which is 3 in New Jabin North and 1 in New Jabin South. We have 3 cases in Takoradi, Sekeni Takoradi, and Wasa Amenfi is 1. So all the other active cases are in Accra. And if you look at the chart there, you can see that the red zone still remain. Accra is the main hotspot. In fact, actually deep red in some aspects. And then other parts in the north, apart from Upper East, the rest is quite, the prevalence is low, or the cases reported. So now, let's take you through what has gone on in Accra. As I said earlier, there's been a gradual surge in the number of cases across the Greater Accra region over the last 1 month. In January, when we had a very high peak, we recorded 4,888 cases. In February, with an average number of about almost 150 cases per day in Greater Accra, it dropped to 2,523 in February with an average of 84 a day. Then it dropped to March of about 5 a day, 152, 5 a day. In April, dropped further to 1.3 cases a day. That's about 39 cases in the whole of April. In May, that's last month, it went up to 399 cases. And June already, as at the 8th of June, we have recorded about 268. I would say this about us at 7th or so, or 6th. As at the 6th of June, we have already recorded nearly the same number, 267 cases. So you can see that there's a gradual increase in the cases in the Accra Metro and its immediate environs. So as I said, currently, of the Accra cases, about 18%, 18.1% of the outbreaks are among children aged between 0 and 15. Obviously, these are unvaccinated children. So the account 18% of this number are in children. I think the next slide is just to show you just a graphical representation of what I described in Greater Accra. You can see that is going up. So if you look at the age distribution, you can see that 0 to 5 is 3.8%, 6 to 10 about 6.9% of the cases between May and June, and then 7.4% about between 11 and 15. So that together is the one that makes up the 18%. So the youth becomes a very critical group that we need to take a look at. And because not most of them cannot be vaccinated now, the protocols have to be stepped up in wherever they are to ensure, and they come home to show. In fact, the youngest child who had was 6 months. The sibling came from school and infected, of course, the family, including the baby. So that is the situation we have now. The next slide is just our usual active case, even though it's still down, but if it's just because it's less lifted up, we need to really act fast to ensure that we are able to bring this under control. So what are the key factors? I mentioned some of them, but I'll just take you through them again. There are seasonal factors. Ghana generally records a high increase in respiratory infections on the onset of the rainy season with peaks in July. So we haven't reached the peak yet. So there's also further evidence that the increase in influenza infections peaked from the existing influenza and other respiratory sites are there. We have increased number of cases, as I mentioned, in the workplace and out and in schools, and that's also accounting for that. And I think the the schools already recorded over 60-something cases out of the 400 we are talking about. Of course, the declining protective effect of the vaccination. I mean, the longer, that's why we are also encouraging people who are due for booster to go for their booster, because the antibodies will decline over time. Especially 6 months after the last vaccination, the immune levels come down a bit. So we have, with working through Greater Accra, we've enhanced surveillance activities across the region, especially in the schools and workplaces. And we continue to advocate that the schools should still continue using the mask. What is happening is that mask wearing is not compulsory, but we need to ensure that we protect ourselves. We are also doing rapid COVID antigen testing in public health facilities for early detection. We distributed antigen tests so that tests can be done quickly for us to be able to see cases before they blow out of proportion. Our case management teams are on alert to ensure that if there's any need for treatment, they are ready to treat. We have enhanced education, and this is one of them. And we also enhanced our vaccination drive. Greater Accra has started their vaccination campaign since the 31st of May, just to keep on the drive, even though we are going to do other campaigns. Greater Accra has had to start theirs much earlier to mobilize more people to get vaccinated and to avert any catastrophe should the numbers go up. So if you see the next slide, you can see Greater Accra also picking up at the end after the last Omicron surge, or Omicron spike. So that is what, as far as the numbers for COVID is concerned, it is, and so we are seeing a gradual increase in the active cases and the number of cases, like I said, in workplaces and schools. And this was the message you have always get, that these are, workplaces, a mass gathering in boxes. Once you remove the walls, it becomes a mass gathering. So we need to really protect ourselves. Let me now take you to the vaccination. Broadly, we have so far received about 32 million vaccines, and currently at the national level, minus what is in the regions, we have about 7 million doses of vaccines still available for distribution. And I'm sure we have probably a similar number stocked in the regions for uptake. So all regions have vaccines, and they are continually vaccinating people. We have so far done 15.8 million doses. That's what we have given. Our target is 20 million by end of June. We have 3 weeks to go. So all of us, we have a lot of work to do to be able to look. But if you look at the map as shown there, you can see that the deeper the coverage. And so you can see that places like Volta, OT, Eastern, the coverage is quite low. Western, North, some parts the coverage is low, but Northeast and Upper West, the coverage seems to be higher. But you see, you look at where the cases are really high, that's where also the percentage coverage, because the populations are large. But so if the percentage coverage is low, then the risk of transmission is high. Now, if I show you the next slide, which is our worry, you can see that this is by district. So after you've seen the green in, say, Upper West, you can see that around Tumu and that area, the coverage is very low. And that is where the danger for, if there's any further outbreak, these are the people in the rural areas who are more at risk of not only catching the virus, but also getting severely ill. So we need to really look at that. So you can see the whole of Volta region, every district is not adequately covered. A large chunk of OT is not covered. Eastern region has a large chunk of districts that are not properly covered. If you come to Greater Accra, is okay, but towards, I think that's the Adan side area, the coverage is very low. And so if the Greater Accra cases start moving into Adan, you're going to have a major surge, and people are going to get sick because most of them are not vaccinated. And so it's a half-full. So you can look at the map and see Bono is the portions where they are. So even though the first graph shows that this is the regional coverage. But if you zoom further, you can see that there are areas in the region where coverage is significantly low. Anywhere you have yellow color, that means that it's really, the coverage is quite low. So that is the area that we need to really focus on. That's where the next vaccine campaign will be focusing more on. If you look at the vaccination drive, in December we did about 2 million, January almost 2.5 million. By May we did 834,000 cases. June we've done 327,000 cases, which is, if this trajectory continue, definitely we are going to get more than we had in May. So that is the situation. So we need to really increase the vaccine drive and ensure that most people are vaccinated. And this just shows the update for adolescents and schools. This population accounts for about 2.5 million people. So far, only 354,000 of that group is vaccinated. So the next vaccination drive, we are going to focus not only in the rural areas and other places, but also for the youth to be able to get vaccinated, because they are the ones who are maybe spreading the virus to other parts of the country. I think this slide is just the regional distribution as shown in the map showed earlier. So as part of the way forward, we're going to improve the vaccination drive. Starting from today to the 12th of June is one campaign, and then 24th to 28th another campaign. But the issue is that we are going to be in the campaign mode from now till the end of June, so that to get many people vaccinated, so that if the surge is not immediately contained, at least we are able to avert people falling sick and creating congestion at our facilities. Currently, we are okay. So that's it for COVID cases and the vaccination. I'm sure there will be questions. But I want to just give you a small update on the influenza. I can see that a lot of people have flu. So you don't know whether is it COVID or is it the other one. But we have the two currently, because this is also the season for respiratory disease with the big onset of the rains. Because of that, we have sentinel sites across the country where routinely samples are taken to see whether the virus is there. We've expanded from the 10 to 16 regions, so all regions have sentinel sites in the country to be able to test for influenza H3. This sentinel provides opportunity for circulating viruses causing the population to be identified, so we are able to detect it quickly. And then we test them in clusters of people who have respiratory illness. Recently there was an outbreak of respiratory disease in one of the schools. We picked samples, not everybody samples, and we're able to identify that we have the H3N2 in the school, and so we need to set up a system to prevent further outbreak. It is also the influenza A virus, the commonest virus identified from the sentinel sites, and then we have the H1N1 and then H3N2. I think H1N1 was the one that appeared in Kumasi Academy recently. But then the majority is now the H3N2. Cumulatively, we have taken about 3,460 samples in the 16 sentinel sites, and we have 773 confirmed as influenza A3 positive. The first case was seen somewhere in January in Eastern region, and starting from April, we started seeing a peak going. I'll show you the charts for that. So you can see the number of cases from sentinel and the non-sentinel. That is those who report to the facility of illness and we test them. So that is and they will have a positivity rate of about 22.3%. So if you look at the next slide, it shows you where the first case was. This is week 3, it's in January. And then you come to April, that's when you see the peak of more cases for influenza appearing. So that's also accounting for the flu and the confusion that we are having. Is it flu? Is it COVID? But I think for us, we assume it's COVID until you test negative. Next slide. I think this is just the distribution across the regions. So the how you manage the flu is the same as COVID. The same appropriate cough etiquette, social distancing, face masks, especially when you are unwell and respiratory symptoms. If you are unwell, please, I know that's difficult. That's when you can't breathe, but that's when you also need to wear your mask to make sure you don't also transmit to your loved ones. Hand hygiene is very important, and of course, where there's vaccination, you can also get a vaccine. In other parts of the world, they get their flu shots every year. Okay, so that's it for, I'm sure we'll take questions on that area too. So the next one is the monkeypox. I'm sure of late we had a lot of talk, social media discussions on monkeypox, and I think the most popular one was the one from Western region. And it was negative. We told it was not bad, so we tested it's negative, so that was not positive. It is, monkeypox is diseases that are transmitted from animals into man. It's very endemic in Nigeria and Cameroon, but it's generally in West Africa, but it's more prevalent in Cameroon and Nigeria. Like I said, from infected animals, squirrels, rats, dummies, monkeys, etc., then they infect humans. The human-to-human transmission can also occur, but it has to be very close skin-to-skin contact, face-to-face contact, or mouth-to-skin contact. These are the areas, that's how you can transmit from human to human. It has one case, let me see, go back. You can also be spread through touching of bedding, towels, clothing, objects used by an infected person. And I believe that earlier, the last 2 weeks ago, we sent an update on the things to look out for. So far, since the outbreak in Europe occurred, we've tested 12 suspected cases in Ghana since 24th of May. Currently, we have confirmed 5 cases in 3 regions, Eastern, Western, and Greater Accra. This is where we've found the 5 cases. No deaths has occurred among the cases. One of the cases has been recorded in a Ghanaian who traveled to the United States from Ghana. So I picked it from here. It shows as fever, some swellings in the armpits and groin with the lymph nodes. We have headaches, muscle aches, and general body aches. That's how it went. And then, of course, the rash and the blisters will appear. That's how monkeypox is. That doesn't mean that every rash is monkeypox. There's clearly no treatment for monkeypox. Fortunately, it's a mild to moderate case, and so, especially the West African one, is mild to moderate. So we only treat at the symptoms. If you have fever, we give you something to bring your temperature down. Body aches, we give you some painkillers to bring it down. You must make sure that the skin lesions are kept clean. You boost your immunity through adequate nutrition and hydration. There is a vaccine available now, but it's currently not available in Ghana. I don't think we have reached a stage where we need to call for vaccination of the cases. So prevention is the key activity that we all must embark on, and also early detection and reporting if you see any rash. So avoid skin-to-skin contact of any infected person. Make sure your hands are clean. Object surfaces are all clean regularly to avoid any spread. And then I wear masks if you can't avoid close contact with the person who is infected, especially when handling beddings, towels, and clothes. We've done a lot so far, and I think most of the media has seen the first alert that was sent to all our hospitals. That's our usual process, that once we pick any, even if it is not in Ghana, it's picked outside, we alert all our health institutions to be alert to make sure that if you see a rash, then you have to also think about monkeypox, so that we can detect it early. We have also shared the general information to the general public. Yes, general public, and I think you've seen that green one. And then we have also sent sensitizations of clinicians, and then we've currently started contact tracing. So any case we have, any contact we have, any positive case, we do all their contacts to make sure that they are okay. We can test of this. We have the capability to test for monkeypox, and this can be done in Oguchi, the National Public Health Reference Lab, and the Kumasi KCCR, that's the Kumasi Center for Collaborative Research. That's where we can do. So, in summary, we have recorded 5 cases. They are all well, nobody is critically ill, and that we continue our surveillance to ensure that all cases that are identified and isolated. So generally, I just want to start ending by saying that we are experiencing 3 different outbreaks: an increasing number of COVID-19, influenza A3, and monkeypox. Maybe we are more critically looking at the monkeypox, that's why we have found them, but it's still an outbreak. All cases of infections may stretch the health system if especially COVID escalates beyond where we have now. We must increase the vaccination for COVID to really curb this surge and avoid any undue pressure on the health system for when people start falling sick. And we must, in fact, I think that should be underlined, that indoor wearing of mask, and all high-risk cases, such as mass gatherings, please make sure that you wear your mask. The last time I came here, I said, I will never enter a lift without wearing my mask, even if it's empty. You don't know whether the last person coughed before coming out. There are pharmacy shops who are selling, if you are not wearing mask, community chemical, you are not wearing mask, anybody with the flu is coming to you. So we need to assess the risk and make sure that we wear the mask. And indoor, before infect 8, then in a very short time, I'm seeing you saw how Omicron just rose in a week. And it's the dominant variant is still the Omicron. Okay. So we want to thank all our partners for their support, especially the media and all our partners, health partners, the Ministry of Information, for the wonderful opportunity they create for us to educate the population. Thank you very much.
Thank you so much, Dr. Kumar Boaji. I believe if you paid attention to his presentation, you would be rest assured that the Ghana Health Service has capacity to bring any of the 3 outbreaks under control. But as Ghanaians, as I always say, we have to play our part. For COVID, only if you get vaccinated. And these days, the vaccines are everywhere. I took my jab at the Achimota Hospital. Ganoff, everywhere. You don't even have to join any long queue. You get there, they are under some canopies, and they are ready to take your information and then give you that jab. So please get vaccinated. And also, if we will follow the hygiene protocols, as Dr. Kumar Boaji mentioned, it will make their work easier. So please, let's adhere to the protocols. Ladies and gentlemen, we will now take your questions. We can take 2 sets of questions. So if you have any question, you raise your hand. David will bring the microphone to you, your name, media house, and then proceed to ask your question. Okay, so we have one person in the back.
Thank you. My name is Sarah Apenkro from TV3. I first want to find out from DG, from the projections of the disease, is there any potential of us getting into a difficult situation, like an emergency situation anytime soon? And I also want to find out to what extent would we start opening up our holding centers which have been closed? And I also want to find out how many people show up currently every day with COVID cases, suspected COVID cases. And do we have enough PPEs in case of a possible surge in the country because of the fact that the loan for the PPEs was rejected by Parliament? And finally, I also want to find out which areas we are recording more of the flu. Thank you.
Thank you, Sarah. Please, we will take more questions if there are any, and then go to DG for his responses. Please, if you have any question, this is the best time to ask. Okay. Okay, yes, please.
My name is Manuel Cranting. I work with Joy News. My question is about testing at the airports. Pretty much before the relaxation of the mandatory testing at the airports, they were the entry point to a lot of the cases that we had. In Doc's presentation, he said that testing at the airports are currently at the lowest level, and he also confirmed that we are not getting any cases there. How does he reconcile the fact that we are not testing and also we are not recording cases? How do we know that we are not importing the cases through the airports? Thank you.
Thank you for the question, Emmanuel. Please, we can take 3 more if you have any. Okay, if that's it, let's go to DG for his responses and concluding remarks.
Thank you very much, Honorable Minister. I think the question is from Sarah. I think 2 questions. We have not closed any holding center or any treatment center. They are just probably not, they are empty, but there's still staff. There is the one at the isolation center in Pantine is open. All our holding centers are open across the country. We've never stopped anything because so they are available for that. As I mentioned, we have increasing number of cases. I think the last one we had about 60 cases. We have 40 cases a day. The majority of them are in Accra, and we continue to publish them on the website on daily basis. So the numbers have moved from 2, sometimes no case in a day, now to 40. So if we don't, I'm hoping that we'll start wearing the mask like we normally do when there's a surge. At this time, we want to start early. Then we can avoid what you're talking about, because, you see, this is not only going to affect the health sector, it's going to affect every sector in the country, including your own workplace, etc. So it is important that because we are a community where you move from school to home or home to work, once you start from one place, nowhere else is safe. And so we need to really work on that to ensure that together we are able to contain. But one of the most important drivers is to ensure that you have your vaccination taken. You get your booster done. If you have adolescents at home, get them to go and get vaccinated, because their protection is your protection. So I think these are the things we all need to do. But if we don't drive all these things, it's still going to go. I think we've seen it before. We've seen us rising from 2 a day to getting 1,000 cases a day. it is possible. The good thing is that because of the vaccination, those who are vaccinated are not likely to fall sick. But we still have a significant number of people who are not vaccinated at all. They may have been exposed, but it doesn't give you enough protection. So please, let's all work towards avoiding what you are looking at. In terms of the KIA, I think as we continue to use the data, we're testing everybody. Vaccination came in. We also realize that the number of people who are vaccinated who are testing positive is significantly low. And so we don't test people who are fully vaccinated. So the people we are testing are those people who are not vaccinated. But even they do a PCR before they come in. So that's why the numbers are down. But they still remain the larger group that can bring in the cases. That's why we continue. So that shows that we stopped removing those who are fully vaccinated out of it, because our evidence from the various ones we've done also show that majority of them are not infected. So that's what the policy is. So we are now doing this number, and sometimes between 50 and 60 people are tested. And we'll continue looking at the numbers to see the proportion. But you see, as long as there are outbreaks in other parts of the world, Shanghai is just opening up. We have them in North Korea. There's a general increase in the US and the Europe. And so we still have to keep our checks to make sure that we keep the importation to the lowest level, which is always the one that will bring in a new variant and then also the spike. So that's what we are doing. Thank you very much. So thank you very much, Honorable. Okay. Sir, I think I missed one of your important questions. Yes. I can say now we have some PPEs, but we need more PPEs in the sense that we're still doing our triaging. Our hospitals are still on alert to making sure that they wear PPEs to manage suspected cases. This is not something we've done. And so should there be a further surge, obviously we'll run out of PPEs. Thank you.
Thank you, DG. Okay, I've seen Nana's hand up and Sarah again. So we'll take Nana's question and then take Sarah's. But please, this is the last set. If you have any question, this is the best time to ask.
Yes, good afternoon, I am Dr. Boaji. Children were not on the vaccination list. Now that they are getting it, are you going to introduce a vaccine for them, or we are going to leave them to their own large? And then, if you have had your third jab, can you still go for the fourth jab, as happens maybe in the US and things like that? That's my question. Thank you.
Thank you, Nana.
Doctors, I asked, you said 773 confirmed influenza cases. I wanted to find out the areas that we had more of these cases. And also, I want to find out what New would be doing towards the vaccination drive, because we've been applying the same strategies and it appears the drive is so low. What new are we going to do this time around to boost up confidence in the vaccine?
Okay, thank you for the question. I take that to be the last question, unless anyone has a question. Okay, thank you.
Thank you very much. The drive for, uptake for vaccine is slow. That's why we are in a campaign mode, and that's why we are moving, not waiting for people to come for vaccination. We are also going to the people, as we've been doing, to get a vaccination. This exercise is one of the ways of trying to link up with them. We are trying to see how we can get MPs to assist us in their constituency to get more vaccinated. I'd like to invite the program manager for EPI to talk about the children's the processes we get in producing children to vaccinate, and then additional booster for those who have taken the last booster was more than 6 months or maybe past the time. Thank you, Kwame.
Thank you very much, DG, and thank you very much, Honorable Minister. Yes, so for vaccination, normally, vaccination drive is actually started when you have the data available. So a couple of months ago, we tabled it to a group that advises on vaccinations, a group of experts known as the National Immunization Technical Advisory Group, which was constituted by the Minister of Health, who advises on vaccinations. The last time we tabled it, the data didn't support the fact that we had to vaccinate children. And so with this current data, when we have, of course, we continue to monitor through surveillance. So when we have data to back the fact that we have to vaccinate children, we'll do so, just as some other countries are doing. But it's early days yet, we still have to monitor. And the second part is about the booster doses. Yes, the ministry has made available vaccines for boosters for every single person. And so at least we can say that for now the plan is to get a booster for everybody. But our original plan is to get at least all persons vaccinated. That is the primary thing before we even think of boosters. But of course, booster doses are available for everybody. But the essential thing is that we should get those who are eligible to get vaccinated, and then the others can follow. Thank you very much.
Thank you, Director General and your team, for making time once again for this all-important exercise. Okay, I think I have one more question here. Okay, it reads, with the available projections of the disease gradually surge, is there a potential we would be getting into a difficult situation, an emergency situation? Doc, would you like to take that?
Yes, I think it's a similar question that Sarah asked. Yes, if you don't do the right things, we are moving from, like I said, in May, if you look at the number of cases, we had 300-something cases. In June, by the June 6th, we've had 267 cases, so it's going up. So the earlier we start, the things we know what to do. Wearing the mask, social distancing, and most importantly, mass gathering in enclosed spaces, wearing your mask. I think when we do that, we are able to bring it down. So I think that is the same answer. There's the potential is there, and that's why we want to start now. That if everybody is alerted, especially now, this is an Accra phenomenon, but everybody is coming to Accra and going out of Accra, so it becomes a real magnet for the explosion to the whole country. All those ones we are finding in Eastern region and this, and they've all passed through Accra. So Accra remains the hotspot, and what we do is what is going to save us from any further catastrophe. Thank you very much.